Hi everyone, this is Alicia Munson, Opportunity Partners Community Outreach and Advocacy Manager, and I'm happy to bring to you today the February 2016 edition of the Advocates Broadcast. Joining me today is Rick Hammergren, our Senior Director of Public Policy here at OP. Thanks for joining me today, Rick.
Thank you, and happy to be here.
So Rick, tell everybody about how long you've been with OP and what your role is here at the organization.
Okay, I've been with Opportunity Partners nearly 6 years, and I have two roles. One is to provide executive leadership for the Transportation Department, and a greater part of my time is devoted to being the Director for Public Policy.
Absolutely. So with Rick's leadership, we've achieved a lot of success in our public policy and advocacy efforts. So thank you, Rick, as always, for your leadership. And tell everybody, what's your favorite part of your job?
Well, I think my favorite part is the activities that we do with the Public Policy Group and helping to coach and mentor folks in leadership roles that they carry on within the organization and with our community partners.
So as you know, the past couple months of our Advocates broadcast have focused on our main public policy priorities for the 2016 legislative session, including the Best Life Alliance and medical assistance reform. And Rick has joined me today to talk a little bit about those more complicated policy priorities that we're focusing on for all the policy wonks across the organization and members of the public, including the disability waiver rate system changes and the Home and Community-Based Services Innovation Pool, or HIP. So Rick, explain a little bit about the problem with the DWRS and what we're focusing on changing this legislative session.
Okay, the DWRS is a new reimbursement system that the state is operating under, and it is the primary vehicle for paying providers. And in the state of Minnesota now, we have more than 100,000 people who are eligible for services under the various waivers. Mm-hmm. More than 90,000 employees in that system. And the DWRS is the reimbursement vehicle for the state to pay for all of those services. What we found since the state implemented this new methodology a couple of years ago is that there are some fundamental problems that we're trying to correct with regard to the way the rates are structured and the way the state has accommodated some legitimate costs. And we are in the process, guided by requirements of the legislature, to study those and to renegotiate some of those elements with the Department of Human Services. So the next DWRS bill, while it will not have a dollar amount attached to it, has some very key provisions with regard to definitions under the rule and how we are going to do cost accounting with regard to our contractual relationships with the state of Minnesota. This not only affects the disability sector, but also all of the waiver services for the aging population under the elderly waiver and the BI and mental health waiver as well.
Okay, so the disability waiver rate system, as Rick mentioned, essentially determines how we're paid for the services that we provide. And the new system led to some inequities statewide and changed some of the rates that we receive. So ultimately, if we're not being compensated according to the services that we're providing, that might compromise some of the services that people receive. It might change the way we receive funding, is that correct?
Correct.
So Rick, explain to us about our other policy priority, the Home and Community-Based Services Innovation Pool. Tell everybody what that's about.
Okay, HIP for short. And HIP is a innovation pool, meaning that the state is going to create a vehicle to offer grants to service providers who come up with innovative ways to provide services to people served. We think they're going to be focused in two areas primarily. One, helping folks to move towards a more independent living arrangement, and secondly, to help people move into community-based competitive employment.
So it would make funding a little bit more flexible to meet the needs that the people we support actually have.
Correct, and also maybe to provide shorter term, more intensive funding for people who are in transition. For example, moving from a enclave or a SEP-like service into a competitive job, so that we could have more intensive staff support for that person for a matter of a few weeks or months.
You can learn more about the disability waiver rate system and the Home and Community-Based Services Innovation Pool on our 2016 legislative agenda. This is a one-page document that provides some brief background as well as a specific ask that we want to communicate with legislators throughout the legislative session. This document is really helpful specifically at our annual Days at the Capitol, which is coming up on Tuesday, March 15th. We're once again going to be partnering with ARM and more to bring together thousands of advocates in St. Paul to make sure their voices are heard. Registration opens today and it runs through Friday, February 19th. If you'd like to register or register someone you support, please contact rroe at rroe@opportunities.org. So Rick, why do you think it's important for advocates to participate in a day at the Capitol?
One of the best things that advocates and people who support advocates can do is to tell your story. So one of the key factors is establishing a relationship on a one-to-one basis between the person served, maybe their direct support professional, or a parent or guardian, with a legislator, so that they understand what we're asking for and why and what impact it has for you personally.
Absolutely. So you don't have to be a policy expert to be an excellent advocate. You just need to share your story. That wraps up this month's edition of the Advocates Broadcast. I want to thank Rick Hammergren for joining me today.
You're welcome, and thank you, everybody. Please join us for Day at the Capitol.
Thanks, everybody. We'll see you soon.